We're back on shift inside the ambulance.
Hello, Black Country! Hey, we're back!
Go, 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 go.
We're with the West Midlands Ambulance Service.
Whereabouts in your belly's a pain?
Does it look bad to you?
As they face more heart-pounding action
Okay, upper chest for me.
Clear! Everyone clear!
and more medical emergencies.
Okay, we've got some good respiratory effort now.
Battling over 4,000 calls each day.
Look, oh no.
Don't cry, darling.
I've had enough, you know.
Look at that.
There are some new faces
Can I wear the team shades? Pretty please.
and some old friends.
I love you, John Stevens.
No, you don't.
Yes, I do. My life has been positively dead without you.
Body-mounted cameras record every moment.
Can we come in and have a chat? Have you got a favourite teddy you want to take with you?
I'm going to need to shave you.
to show you what goes on behind closed doors.
We'll need to call security for these pair. They've been nothing but trouble.
You'll be on the front line with the ambulance crews as we take you inside the ambulance.
And off we go into the royal blue yonder.
Hello, Black Country! Hey, we're back!
Oh, right, let's get that heating on.
It would help if you put the keys in, wouldn't it, really? Get the keys in the ignition first, great.
I'm still loving it, and I'm not bored yet.
No, I'm not.
That's good.
Love it. I wouldn't want to do anything else.
Well, I mean, like, petting dogs for a living.
No, not interested.
Or
Pay somebody to
Cadbury's put up an advert, a job thingy. £9 an hour, 8 hours a week, tasting chocolate.
Wow.
I'd
could
do that.
do
£9 an hour.
It's a chilly spring day in the West Midlands.
My feet are numb.
Why?
Cold.
Paramedics Dina Evans and Mick Hipgrave are just leaving the hub when an emergency call comes in.
4597, I've had to put you onto a C1. It's a cardiac arrest in Telford Shopping Centre.
It's the most serious call-out the crew can get, and from now on, every second counts.
That's all received. It's not yet come through to the CAD, but we are en route.
This has come through as 85-year-old in the shopping centre cardiac arrest.
There's heavy traffic on the roads and building work outside the shopping centre, which is costing them valuable time.
Yeah, we can go over pavements, but
It's going to be tight. Yeah, go around that side for that one car.
this is ridiculous.
It is bad. It is stupid. Definitely cardiac arrest, according to this. You're right.
Another crew are already at the scene.
Where are we going?
In the corner here, straight. Where is it?
They arrive to find 85-year-old Elsie unconscious with no pulse. She collapsed whilst out shopping. A member of staff is performing CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Change.
Dina takes over giving chest compressions.
What time did this happen? Look, why is her mouth bleeding? Get the teeth out. She looks like she's bitten her mouth or something. Yeah.
What rhythm you got?
She's been shocked 4 times.
4 times.
You're right there.
2 seconds, just stop, just one. Keep still, got bouncing.
The old gels, isn't he?
Still, got bouncing.
She's breathing. She's gasping.
Hold on.
Right,
Do not
carry on.
touch patient. Analysing rhythm.
Incredibly, Elsie's heart has started beating again.
CPR.
She's got a pulse.
I've got rid of him. Have you got rid of him? Fine.
But she's still in critical condition.
Her heart stopped beating for up to 15 minutes, so technically she's classed as being dead for that period of time.
Is she breathing for herself? She's gasping, right, so I'll come behind her and we'll do her top and tail.
It was very important to get Elsie to the ambulance very quickly, so we used some quite quick techniques to get her onto the stretcher.
Sit her up front, bend her in the middle. Yep. Okay, right. I got it. First, I got it. I got it. I got it.
Elsie could have another attack at any moment. The crew need to get her to hospital as quickly as possible.
Watch yourself, mate.
Her heart is beating, but her breathing is weak.
Steady on that, yeah.
Yeah.
Dina and Mick are taking Elsie onto the first crew's ambulance.
She's assisted vents at the moment. Right. Okay, we've got some good respiratory effort now.
Like, you travel with me doing airway?
Yeah, I'll keep the airway going. She's breathing for herself at the moment.
Do you want this? Before I disappear off? Just
yeah.
in case.
It's fine. Just, can somebody get the ALS bag out, Red, the drugs, just in case? Okay, Smithy. That's it. Relax.
Mick will stay with her to keep her breathing, while Dina follows in their ambulance.
See you at the hospital, Dee.
Yeah.
Okay.
So 12 one, we've got...
So, we'll just grab a blood pressure. Probably this side, I think, because this cannula doesn't seem to be... Oh, she's bleeding from that side now, though, so... Get some tissue.
You right?
Yeah, got it.
Do you want it on this side or that side?
Either. Whichever.
All right, my sweetheart.
Oh, pupils are reacting. That's good. Excellent. Both reacting.
Good.
I've got a good feeling about this, that we're going to get a good outcome here.
They are at the hospital in under 10 minutes. Mick can hand over Elsie to the resus team, breathing for herself and with a fighting chance of surviving her cardiac arrest.
How was she in resus?
She was holding her own, her rests were good, her pupils were equal, reactive. She was making some sort of effort to
Yeah, she was making effort when we got... Oh, to communicate?
Yeah, towards the end. I think we've done as much as we can. I think we've given her a very good chance.
Probably one of the most embarrassing things is putting the ECG leads, when the limb leads on, thinking not getting a reading, and then the patient saying, yeah, that'll probably be my false leg. Either that or checking the pupils and thinking, well, they're not reacting.
That was not reacting.
It's like, yeah, it's my glass eye. Out it comes.
Regular crewmates V. Hodgkins and Ollie Raven are nearing the end of their 12-hour shift.
Blimey, another job. No rest for the wicked here, is there?
We've got a Cat 2, a 66-year-old gentleman. It's called from 111. He's vomiting, he's got breathing difficulties, and he's unsteady on his legs.
The call for help came from the patient's wife, Elaine.
Hello, my darling. All right. Okay, where are we? In here?
Yeah.
Hello. All right, hi there. Hello, is it Arthur? Hello, Arthur. Paramedics here, okay? Well, why are you on the floor? That's a good question. Have you fallen?
No.
Have your legs given way?
The legs have gone.
Your legs have gone? Okay.
He's blind as well.
Gone down, Grace?
He's blind as well.
Okay. Did you keep getting out of breath, is that right? Could you have any breathing problems normally?
Not normal, no.
No? How do you feel at the moment? What's your worst symptom at the moment, Arthur?
His stomach.
Okay.
Arthur has a complex medical history, including bowel cancer. V and Ollie need to do some more digging to find out why he's feeling so unwell today.
Are you diabetic as well, Arthur?
Yeah.
Yeah.
Type 2? Okay. Okay, that's job scratch. Do you test his blood sugars for him?
No, he takes it himself.
Right, okay.
With Arthur's diabetes, he should be checking his blood sugar levels several times a day.
Your blood sugars are high. Yeah? Very high. When did you last test your blood sugar, Arthur?
Oh.
Be honest.
Honest?
Yeah, honest is good.
About 2 months ago.
High blood sugars can be quite dangerous, yeah? So my machine's reading high. It doesn't give me a number. It's too high to register a number, okay? So we need to get you up to the hospital, okay? So it was very concerning that Arthur hadn't checked his own blood sugar levels for several months. Poorly controlled diabetes can be fatal.
Arthur needs to be seen by doctors urgently.
Take this arm off you, Arthur. Yes, certainly. Let's just, yeah. Yeah, I need to get to you, this part of you. Bob your tongue out for me if you can. Okay. You've been drinking a lot more than normal. You've been very thirsty. He's pale, he's dehydrated, he's got high blood sugars, he's been vomiting, there's every chance he's DKA.
DKA, or diabetic ketoacidosis, is a serious condition that diabetics face when their sugar levels spiral. If left untreated, it can lead to a coma and eventually death.
How long have you been diabetic for, Arthur?
About 30 years.
30 years. Have you ever had to go on insulin?
Yeah.
You're not on insulin at the moment?
Yeah, yeah.
You are? Oh, we didn't get that bit of information. You're a type 2 on insulin as well?
Yeah.
And are you taking that properly?
No.
No.
Why not? How do you know how much insulin?
A couple of days ago.
Oh.
We were quite shocked to find out at a fairly late stage that Arthur was insulin-dependent diabetic, even though he was type 2 diabetic. He would have been made fully aware of how important it is to keep on top of his sugar levels, to monitor them, and also to take his insulin and other medications properly and as they're prescribed, to keep on top of those sugar levels to prevent the complications that he was experiencing. That's all the straps on.
Thank you very much. Right, I was going to let the hospital know that we're coming. So it means you get a ride on blue lights, okay? So don't worry about that. That's because I'm worried about your blood sugars, yeah?
You happy?
Thank you very much.
With Arthur's blood sugar seemingly out of control, V needs to prepare for a swift handover to the specialists at the hospital.
Arthur. Arthur.
Yeah?
I'm sorry, I need to answer these questions, yeah? Because I need to tell... You can talk to me.
My stomach bad.
How are we making your stomach bad? Yeah?
Rocking around and making my stomach bad.
No, I'm sorry about that, but... Yeah? They're designed to get you to hospital, yeah?
Yeah.
I'm going to undo this because you've wriggled down. It's going to strangle you in a minute. So you've got high blood pressure, yes? Yeah. Okay, type 2 diabetic that's on insulin. Yeah?
Yeah.
Okay, we're just putting in now, all right?
The roads are clear and they reach A&E in just 10 minutes.
Okay, happy to come down then?
The doctors at the hospital will now work to bring Arthur's sugar levels back under control.
Just let me get that over, okay? Okay, let's go and get your blood sugar sorted. Arthur was different to what came through on the system, wasn't it?
It was, yeah.
Insulin-dependent diabetic that's not tested his blood sugar since October. So, just not taking good care, really, was he?
No, not at all.
So, blood tests for Arthur then, see if he is DKA, and hopefully, you know, diabetic nurse to come and keep an eye on him, as he's now had a hospital admission for high blood sugars.
Yeah, exactly.
It's just before 4 p.m. in Dudley, and paramedics Nicole McClintock and Lee Farley are on shift together.
We're going to a 12-year-old male who has accidentally cut his wrist and his hand on a query stick. He's jumped over a wall. That's all the details we know at the minute.
They arrive in less than 2 minutes, but finding their patient is trickier than expected.
No sign of anybody, is there? It's that time of day though, isn't it, with kids coming out of school? That
Yeah.
This is when we do get malicious calls. 5-7 in attendance, no sign of incident. Do you have any further directions where this patient may be over?
Just having a look, there's nothing the case now.
Somebody walking
I'll
down.
give them a quick shout and see if there's any updates.
Hoax 999 calls are fortunately not that common, but they do happen, and crews will always treat every case as genuine. But sometimes patients can be hard to track down.
Sorry mate, just as I said that, I was just going to say, patient is now inside the pub. No, it's literally just gone on now. That received of it.
Yeah, got that, thank you.
Inside the pub, they find 12-year-old Liam, waiting with friends and bar staff who've given his cut hand first aid.
Hello.
Hello.
Hello, you Liam? Hello there.
Oh, what's happened?
I was running and then I went to like jump over like the pool just out there. Around the pool. And I landed on my stomach and I don't know what it was, but it just like
Okay.
Do you want to take him straight to the ambulance, which is a bit quieter, a bit private?
Yeah.
Come on.
Liam was on his way home from school and playing with friends when the accident happened.
Climb aboard.
Let's set it up for you a wee minute, just to have a look at you. Relax your hand down, take that. Let's have a look.
Does it look bad to you?
Paramedics Nicole and Lee are treating 12-year-old Liam, who's cut his hand while climbing over a wall.
Does it look bad to you?
Gonna have to give it a clean, okay? And it's gonna sting.
How bad?
A little bit.
I'll just put that on your lap. Okay.
You hold that again.
And just give it a wash.
When my hand stopped bleeding really bad.
Oh no!
Any dirt or anything in the wound could make it go infected. That's why we need to clean it. Okay? We'll just give it a bit of a scrub. This only just happened.
About 15-20 minutes ago.
Did you get a free bottle of Coke out of it? So it wasn't too bad
Oh,
then.
that's
Yeah,
something,
thumbs up, yeah. They're very nice in the pub then, weren't they, to give you that? If I tell them I've fallen over, you think they'll give me a drink? What do we have to do to get a free meal?
What I'm gonna do?
Just let your hand sit on your leg. That's it, just relax. She's going to sting a little bit. All right. If you talk to me while Nicole's cleaning it up. Look at me. All right. What year are you at school?
8.
What do you like about school?
Not much.
Not much. How did I know you were going to say that? Yeah. What do you want to do when you leave school?
Not really sure.
Do you think you could be a paramedic?
Probably if I tried.
If you tried, yeah. As long as it's other people that you're patching up, it don't matter, does it? Yeah. It's when it's yourself, it gets a bit worrying. Any other brothers and sisters?
Yeah, I have one older sister which is 14. I have one disabled sister which is like 9 years old, and one of my brothers called Brandon is 8 years old.
Yeah.
And Jack is the youngest and he's 5.
So there's 5 of you all together?
Do you think I'll be at school tomorrow or not?
Oh, why not?
If my dad offered me the chance to go to school or not, I would say no.
Yeah, I'm far too poorly to go to school.
You don't like school?
No.
Is that right?
Oh my goodness.
That actually might need a stitch or two.
It's quite deep now.
Yeah, now that I'm getting into it, yeah. So
It's quite deep.
So that's going to need a good clean, yeah. And then I think it may need a stitch or two. All right, but what they do is they make all the area so that you can't feel it. What we're going to do is put a clean dressing on it and put a nice bandage on, and then we'll see if Mum's here or Dad. All right.
But last year my mum passed away.
Oh, I'm sorry. So Dad's your main guardian now.
Liam's dad, Gary, has arrived to be with his son.
It's nothing too serious. Basically, he's fallen, jumped over a wall or something. And what he's done is that he's cut his hand. It's a bit like jagged. We've given it a good clean up and that, but it's going to need some closure and then give it a good scrub and then probably just a few stitches.
It's just stinging a bit from earlier.
Come and jump on board and...
Hello. You're being super fun.
So we managed to get a free drink off the pub as well. Do you want to carry on drinking that now? Yeah? Let me you want to pass it over. She was leaving it there, so she was going to finish it, you see.
Liam's dad will now take him to the minor injuries department to have his wound thoroughly examined and treated.
Initially, my thoughts were, we're only around the corner, the calls came in. There's nobody to be seen at all.
Hope's call.
Exactly. The children come out of school, and that's what I thought we were facing. But sensible though, he's gone in the pub, he's obviously raised the alarm.
Initially when I seen the cat, I thought, there's not much to that. But when I started explaining it, I thought, God, that's actually quite deep.
No, I agree.
But he was very brave.
He was.
Very brave.
But he didn't want to go to school tomorrow. I don't think he'll be jumping over any more walls on the way home from school.
The best part of the job, going and seeing everybody's dogs.
Oh, look at that dog. Hello. Peekaboo.
What was that, a puppy?
French bulldog. Really expensive now.
Are they?
Like £2,000 for the pedigree puppy ones.
Yeah, they're still a dog though.
Yeah.
You've still got to walk it and pick up its poo.
Oh, this looks interesting.
On shift together are identical twins, Lisa and Catherine Hickman.
We've got 81-year-old who's fallen on the escalator. Oh, pain in her shoulder. Oh, she can't get up from the floor. Oh, bless her. Oh no.
The 26-year-old sisters are on their way to the supermarket, where patient Mary has fallen over.
It's not the place you want to fall, is it? In front of everyone. I hope she hasn't brought a frozen food as well, because that'll melt. They'd probably freeze it for her, would they?
Don't know.
I'm sure they would. Yeah.
The twins lived together, studied together, and qualified as paramedics 6 months ago.
I literally went to someone last week who'd fallen down an escalator at Tesco, but a different one.
Just ahead.
Really?
Yeah.
So people can tell them apart, Lisa wears her hair in a plait and Catherine ties hers in a ponytail.
This shop's going to be busy.
I try not to hang around in the shop too much, just so it's better for her.
Give her a bit of privacy.
Yeah.
There's a member of staff waiting for them to arrive.
Hello.
Hiya.
She's banged her shoulder.
Yeah.
She said it's clicking. She's shaking. And
Oh, okay.
And she's on cancer tablets and she takes a morphine. Twins, aren't
We are, yeah.
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 Yeah, so I double take when I was there.
Mary was shopping with her best friend Pat when the accident happened.
Hello there. Hi, are you Mary?
Hello,
Nice
Mary.
to meet you, Mary.
I think you had a fall today. You fell backwards. Did you feel poorly before you fell? No.
I was with her. She's got the trolley and I'd got the trolley.
Yeah.
And then you've got to push it. But I don't think, when we got to the top here, there's a bit of a slope and Mary didn't, and was gone.
Yeah. Okay. And where's your pain at the minute, Mary?
It's just, I've looked, I can't see anything on her shoulder, but she said whether she's just jarred it, I don't know.
Well, it's a bit pushed forward, doesn't it?
Yeah. Yeah, it might be a bit out of place, maybe. I think when you first see someone that's had a fall, we're most concerned that they might have injured their head or their neck or their back, aren't we? As she was sat in a chair, that's a good indication that she wasn't too seriously injured, but you never know, do you, until you've actually started to examine them and get a bit of a history.
Mary, did you hit your head at all? No, you didn't.
The trouble is, I've got cancer, so
Yeah.
the nurses come every day, and I'll be back at my house for 12 o'clock.
Do they give you medication or something?
And I haven't got it, just take
Mary was first diagnosed with breast cancer 15 years ago.
Have a little seat for us then.
She had a mastectomy and was in remission until 2 years ago when her cancer returned.
Did you manage to do any shopping? Oh no.
Oh, what a shame.
That's the worst part.
Lisa and Catherine want to check Mary's injuries properly in the privacy of the back of the ambulance.
Just get the back open. Okay, Mary, can I help you with your feet? Just pop them on the floor for me. Okay. I'm not going to pull on your bad arm. If you push up on your good arm and have a seat here for me. Okay, that's it. Lovely. We'll do a few checks on you, Mary, and we'll have a proper look at your arm. Oh, your nails are lovely. It's a nice colour. Oh, nice. And you've been moving it quite well, haven't you? Is it causing you a lot of pain all the time, or just when you move it?
No, just when I move it.
What we can do, we'll do some checks. We can put it in a sling to stop it moving so much, if that would help.
I'm worried about my friend.
Let's just roll that up.
Store.
She's gone to pay for the shopping, I think.
Yeah, but they haven't told her. Have they?
She knows we're taking you here, yeah.
Yeah,
if she wants, you
knows.
can knock on the door.
Mary and Pat have been friends for nearly 60 years. Pat always takes Mary on her weekly shop, as Mary can be unsteady on her feet.
Hello. Oh, hello. Are you all right if she comes in? Do you want her to come in? Yeah, you can come up if you want.
Go on, have a seat there. Right, if I can slide this under your arm there.
The fact that that shoulder is causing you quite a bit of pain, especially when you're moving it, and you're saying it's top of your arm as well, it is probably best to go get checked out. They might want to x-ray it at the hospital. Is that okay with you?
Pat's my best friend, but she's also got things to do outside of helping me, you know. All I'm thinking about is this care of Mary.
Mary lives with her son Matthew. As he works full-time, Mary has a carer who visits twice a day.
I mean, would it help if we spoke to
Is it Matthew? Is it your son?
I don't know it is.
You don't know the number?
I don't know where he works. He's in the Black Country somewhere, I don't even know. He'll ban me from taking you shopping.
No, don't let it put you off shopping.
Bless you, the glass cage.
Oh, so he cares about you, but maybe too much. A little bit. Does he worry about you a lot then? Is that the... It's up to you, Mary. We obviously advise a trip to the hospital because we can't tell if you've broken anything, especially if you are on cancer treatment. It might mean your bones are a bit weaker, and we've got to consider your age as well. But we're just not X-ray machines, so we can't guarantee anything. Don't let worrying about the carers stop you from going.
You've got to stay or go.
It's up to you, Mary.
What are you going to do?
I'd rather go.
You'd rather go where?
Go back to mine.
Mary, all we need to make you aware of is that we can't guarantee that there's no break there.
Yes.
Okay. With that kind of movement, it's unlikely, but there's still a chance.
Perhaps I think our best bet is to get back.
I'm sure that's what you want to do.
Go back home.
Yes.
Okay.
Right, you're my witnesses.
Yes, we're witnesses now. But obviously, any problems, like we said, pop yourself up to A&E.
I think Mary wanted to go home because she didn't want to worry anyone. She seemed so concerned about the carers more than she was for her own shoulder.
We can't force her to go, and she knew what to do if she had any more problems with her shoulder, so we were confident in letting her go home.
I think Pat was going to look after her as well, so we know we were leaving her in good hands.
Mary's going home, where she can keep her appointment with her carers and rest until her son Matthew returns from work.
I hope you're feeling better soon.
Thanks a lot.
No problem. See you, Mary. Oh, I hope Mary's going to be all right. I'm sure she will be. It's a shame she just hadn't done a shopping first. Do you know what I thought that? I thought that. You wouldn't mind so much if you got what you wanted. Pat seems like a good friend to her though, doesn't she? Pat does. Oh, I think that's lovely. I bet they've been friends for ages, haven't they? It melts your heart, doesn't it?
Go away, Snow.
Do you know who doesn't have a snow day? The NHS.
It's all right when you're a kid. You love it, you're going to play all day.
Yeah.
When you're an adult, you have to learn to drive, innit?
Sucks.
What you like with a shovel? I cleared one of these bungalows drives one year in the snow.
Did you?
Yeah, so we could get a lady out. Cleared all the path.
And then she decided she didn't want to go.
No, no. We did the wrong address, no.
Yeah.
She was next door.
It's just after midnight on a snowy Saturday night. Matt Rodwell and Rachel Whalen are trying to get to their next job, but the weather is making things tricky.
So we're going to need to kind of assess whether we're likely to get stuck.
I'll pull it round onto the car park.
I've got to be honest, I would abandon it here.
You think?
And then we can go down, or we'll just reverse all the way back up.
Yeah, if I'm reversing, someone's come to the door for us.
All the crew know about the young woman they're trying to reach is that her name is Courtney and she's struggling to breathe.
How are we doing, mate? You okay? Are we here for you? No. I was going to say, you look remarkably well for someone that needs an ambulance. Thank you.
The patient's friend Anya called the ambulance when Courtney became ill.
Thank you.
Good evening. How are we doing?
Hi.
Who's Courtney? How are we doing, Courtney? Nice to meet you. My name's Matt and this is Rachel.
Hi.
What can we do for you today, mate? When did this start?
An hour ago.
She's pregnant. She has got asthma as well. She has been taking her around, but it don't seem to be like working for her at the minute.
Okay. All right. How do you feel at the moment in terms of your breathing? Does it feel tight? Okay. Let's have a quick listen.
Do you want me to move?
No, you good, bro. I want to see yourself. Just relax for me.
Courtney and her friends were having a small party at her flat when she started to feel unwell.
Sorry, so what have you been up to for the last couple of hours then? Just been sat here?
Yeah, sat here with a few friends.
All right, Petter, we're going to give you a neb. Okay. In terms of taking your inhalers and stuff, has that helped? It's not touched it. Okay. How many weeks pregnant are we?
24.
24. And in terms of the pregnancy itself, you've had no problems? Do you smoke at all, Courtney?
Yeah.
Have you been smoking today? 2. When was your last one?
3 hours ago.
Okay, all right. How have you been today? Like, you been going shivery, hot and cold?
Just got about this week's cold and cold and hot though.
Okay. You had the shivers though? Okay. So we're going to give you this neb. We'll see how you do afterwards. You're very wheezy on your chest. You've also got a lot of fluid at one side. Okay, it's quite difficult to hear because of the wheeze. We'll see if this settles down, but I can pretty much guarantee you're going to have to go to the hospital. It's only because your heart rate's quite quick as well. And generally that's a sign that you've either got an infection, okay, or you're working quite hard. And in fairness, you're doing both at the moment. Okay.
Courtney must stay on the breathing apparatus for at least 10 minutes before Matt can see if she's improved.
Once this is finished, we'll get your jumper off you, because you're quite warm. You like to touch, you're red hot. The more we can kind of cool you off, the better you're going to feel. You're going to shiver, it's going to feel awful, but you will feel better for it, I promise. I lift the back of this top up, Court, is that alright? Sorry. Okay. You've got a rash on your back. Initially, Courtney was presented with signs of an infection. She'd been shivery and hot and cold. She had a temperature, her heart rate was quite quick, as was her breathing rate, and she had heat rash down her back. Generally, these all lead towards or point towards sepsis, which is a life-threatening condition.
Yeah, 25, 130. SATs no, maybe the rash as well, it's not non-blanching.
I was very worried for Courtney, to be fair. She's pregnant as well, which means her immune system's taken a bit of a hit anyway, and she's going to be prone to infections, and it's really important that we treated her quickly.
With Courtney showing some of the key signs of sepsis, time is of the essence. Before they can get her onto the ambulance, however, Matt wants to open up her airways with steroids to help her breathe.
I'd like to pop a little needle in you, give you some steroids. With a bit of luck, the steroid should help to stop the wheeziness. Is that all right? Okay. You're gonna feel this. Okay, it's not going to be that painful, but you are going to feel it.
Just breathe. Don't worry.
Sharp scratch.
Okay. Look at me. You're fine. Look at me. You know, look at me.
That wasn't that bad, was it?
No.
Before the drugs are administered, however, Courtney is showing some signs of improvement.
You know what? I think we might get away with not having to give you some steroids, you know. Your breathing sounds like it's bad and well, please.
With a cannula ready so she can have the drugs if her breathing gets worse again, Matt now wants to get Courtney to hospital.
It's going to feel really scary, just go with it, you're going to be fine, I promise. There's tracks on the back of it, so you're just going to slide down in the chair. You ready? It's going to be, you're going to feel a little bit of a jolt in a minute. There you go. Mate, you are a legend. How's your breathing? Feeling alright? Put this around your arm, darling. So your breathing actually sounds much better than it was, but it's still not great. So we're going to give you another neb. Okay, I'm loath to give you the steroids, just purely because of obviously being pregnant. Although there is no problems with it because we have checked, I'd rather if we could avoid it, I'd rather we would. All right.
With such a potentially ill patient on board, Matt lets the hospital know they're on their way.
She's 20 years old and is 24 weeks pregnant. Yep. Triggering red sepsis. 4 minutes, mate. Thank you, bye-bye. How you feeling?
My hands and my neck feels swollen.
Okay. Your hands are okay? All right. Open up for me. Say ah. Poke your tongue out. Come on. Open up wider. You can do better than that. Ah. Let's have a good listen to your breathing. No, you stop shivering, I might hear a bit more.
It's 1 a.m. and with no traffic on the roads, they arrive in under 4 minutes.
I haven't given her the steroids.
No. There's no point in giving a drug in pregnancy that you don't 100% need to give, is there?
Yeah.
At hospital, Courtney's breathing difficulties and potential septic infection will be urgently assessed by the A&E doctors.
She's got a lot on her plate, hasn't she?
Poorly though.
Yeah, she was struggling with the breathing a little bit.
Chest sounded awful.
Did it?
Inspiratory, expiratory, wheezy.
She'd look a bit better after those nebs.
"85-year-old Elsie, who'd had a cardiac arrest and was technically dead for 15 minutes, has made an extraordinary recovery. She was in hospital for 2 weeks, but is now back at home and doing well. Arthur, the patient with type 2 diabetes, spent 6 nights in hospital whilst the doctors got his blood sugars under control. He's now feeling much better. 12-year-old Liam needed 4 stitches in his hand, which has now healed well. He even got to have the next day off school. Mary, who decided not to go to hospital after her fall, hadn't broken or dislocated her shoulder. She's being well looked after at home by her carers and friend Pat. Doctors assessing Courtney at hospital were able to rule out sepsis. She was diagnosed with a chest infection. Thankfully, her pregnancy was not affected by the incident.
Had a good day?
Wonderful.
I always enjoy working with you.
Hey!
We get a bedside view next here on W when we go inside the operating theatre.